So let's bring Dr. Bio Curry-Winchell, Urgent Care Medical Director over at Carbon Health and St. Mary's Hospital. Doctor, such a pleasure to have you here this morning. Thank you so much for joining us. Could you explain to us what a tripledemic is and why we keep hearing that so often?
So, when we talk about a tripledemic, we are talking about COVID, flu, and unfortunately, a rise of cases of RSV. And so, when you have all three, that is a concern because each one really carries risk and complications that can lead to hospitalization. So, it's something that we have to take note of because it's really concerning, especially this early in the flu season.
And doctor, let's focus for a minute on RSV since that's the new one that a lot of people aren't familiar with, and a lot of parents are really concerned about their kids right now. With RSV, why is it exploding right now, and what exactly is it?
So there are multiple reasons why. We know that because of the pandemic, our little ones were really isolated. And so they weren't really exposed to the things that they normally were. And so their immune systems have slightly weakened, as well as now we have an uptick of COVID and as well as the flu. And so altogether, we have really seen a rise in this disease that we've never seen before. And as a parent myself, it's something that we have to take note and really be mindful to look for those symptoms.
And so, given the symptoms we're showing right here and the things we need to know, at what point should we seek emergency medical attention if we believe that our child has RSV?
So first, I always say, as a parent myself, if there is something that doesn't look right for your child, definitely bring them in. But some of the things that you should look for is if your child is having an increased work of breathing, meaning you're seeing their chest or their stomach really retract or suck in, or if you're seeing a discoloration along the fingers, at the nails, and so forth, and the lips, that can be a sign that they're having a hard time breathing, as well as they often won't eat as much just because they're really struggling to breathe. So if any of those symptoms or just, your intuition as a parent, go in and have your child be seen.
Okay, so what are some of the high risk factors for more severe RSV, flu, or even COVID symptoms here?
So, if your child is less than 6 months of age, if your child has any health conditions such as heart disease, lung disease, and as well as if you're an older adult, meaning over the age of 65. However, if you have any underlying health conditions, that can increase your risk for any of these illnesses.
Okay, so what are the best things that we can do, whether it's, RSV, the flu, or COVID, to try to keep ourselves safe?
Well, of course, the easy answer is always get vaccinated. But for those who can't get vaccinated, it's really important to wash your hands. I always say, even before the pandemic, that was important. So, continue to wash your hands, wipe down surfaces. All of those things can really help, as well as if you're going to be, in a large crowd and you're unsure of the status of others, wear a mask. That doesn't, cause any harm. If anything, it can really help you, your family, and your loved ones stay safe.